Going beyond the headlines. Asking the questions you want answered. Exploring government policies and how they impact you. We are delving deeper.
Good evening and welcome to Delving Deeper. I am your host, Diana Carter. The Suicide Prevention Hotline was launched a couple weeks ago. So joining us this evening are Mrs. Simone Alexander Jakey, Coordinator, Suicide Prevention Hotline, and Ms. Farisha Mohammed, Social Worker at the National Family Services Division. Good evening, ladies, and welcome to the show.
Thanks very much for having us this afternoon.
So, Mrs. Alexander Jakey, let's start with you. What is the Suicide Prevention Hotline?
The Suicide Prevention Hotline actually was established in November 2022, where after the pandemic, our Honorable Minister, Mrs. Donna Cox, saw the need that the citizens of Trinidad and Tobago need such a service. It was an initiative by her. And thus far, we have trained personnel as a 24-hour service to the public of Trinidad and Tobago, and the service is toll-free. So 800 COPE, C-O-P-E. After research and after the pandemic, the World Health Organization would have proven that approximately 700,000 persons would have committed suicide. In addition, when we look at the English-speaking Trinidad and Tobago, we also see we are ranked number 3 in the statistics of persons who committed suicide. So yes, the Minister initiative is very timely. And as a result of this, I want to thank the Minister and the Executive of the Ministry of Social Development and Family Services.
Now you mentioned 800 COPE, C-O-P-E. Who are the persons who can access the hotline?
Every person in Trinidad and Tobago have access to the service. Every citizen, resident, any person who is in a crisis situation, please feel free to call COPE, which is 800 COPE 2673.
Okay. The hotline, you said it's open to everyone. This is not just nationals. It's everyone who is within Trinidad and Tobago, correct?
Correct.
All right. So what about our Spanish-speaking counterparts? Are there bilingual persons on the hotline that could cater to them?
We are looking into having bilingual. We do have some staff members who do speak Spanish. So yes, it also caters for the bilingual persons who speak Spanish.
And Ms. Mohammed, for those who may be a bit skeptical about accessing the hotline, what confidence can you give them that this, if you're in need, if you're in crisis, this is the place to come to?
Okay, so firstly, I would say that the hotline is confidential. We uphold the first ethical principle of the service that we provide, which is confidentiality. So that is definitely your information would be kept between the person who receives your call and whoever it is referred to. However, we are asked for consent for that referral process to be done to a social worker. So that would be the first thing that I will touch on. Secondly, I would say that in understanding suicide, we must bear in mind that the only way to overcome is by talking it out, rationalizing your emotions, your feelings, your thoughts, and by reaching out to someone, that person can help you in making that decision, to choose life instead of death.
So take us through from call to action. When someone calls, what is the process? What happens behind the scenes?
Okay, so someone calls the hotline. As I said, there would be someone on the receiving end who would take that call. You would be probed into asking questions about, the most critical issue that would be affecting you as an individual, where that person will give you some guidance, talk you through to bring you down from, let's say, a 10 to a 1 instability of your emotions. That would be the first process. Secondly, you would be asked if you would like long-term intervention. Long-term intervention is where the hotline would now refer to the National Family Services Division, because we are the umbrella by which the hotline has been established under. So in saying that, when you give consent, or if you give consent, the social worker who is within the jurisdiction of where you live would be contacted, and your information would be passed to that person, where you would receive intervention on a longer term, so that way you can work through issues by empowering yourself. You know, as a social worker, I like to use strength-based perspectives, where we would use the client's strength and show them that you have things that are worthy of, you know, building upon and overcoming any issue or hurdles that you may encounter. And, you know, suicidal ideation can be temporary.
What if I am not the person who is struggling with suicidal thoughts, or, you know, having those types of emotions? What if I am a parent, a guardian, a sibling requesting help from the hotline?
And that is okay. What we encourage persons to do is, if you know of someone who may be having suicidal ideation, thoughts, anything that pertains to suicide, even if it's just depression, what you can do is reach out on that person's behalf, because sometimes a person is too weak to reach out on behalf of themselves, and you as a bystander, you don't want to live with the what if, what could I have done. So we encourage those persons who are in that, you know, the victim's circle, that if you can reach out on their behalf, it's going to, you know, prove as a positive for everyone within that situation.
Ms. Alexander Jakey, our statistics show that over the past 3 years, 4 years, the numbers have increased. What can you say is the reason for that, and how can we help?
So definitely, as I would have spoken before, and say COVID played a terrible and had a great impact on persons' lives. Also, unemployment had some family dynamics, so different situation, and then we also had to look at the scientific or the medical aspect of suicide that would have bring on. Sometimes people feel that, you know, they have no way else out, and that, you know, the only way out is by death. And in truth and in fact, there is help. There's 800 COPE. There's someone who is willing to listen and there for you. Just call us, and there is always someone who is qualified, trained, to help you get through whatever, because as human beings, we all go through some kind of trauma, some kind of crisis, and how do we deal with it is what makes a difference. So we are here to help you to get that over, that hurdle, that bridge, because the clutter in the brain may feel that, you know, there's nothing there, nobody's to support, but we do have support system in place. We have referral, we have internal referral, and we do have external referral systems for the clients, and whatever may be the situation that is, you know, having you feel like your back is against the wall, we have some kind of mechanism to help you get over that hurdle.
One of the statistics that Minister Cox would have referred to at the launch of the hotline is that older persons 60 years and over, there have been an increased rate in suicide among that age group. Is it the same sort of reasons you think that these persons are also choosing that way?
Some of it, yes, most definitely. And some of it could be also be a contributing factor of breakdown in the family life, dementia, Alzheimer, feeling loneliness, so, you know, feeling rejection. So some of these couples will bring that impact. Terminally ill, being terminally ill could also be a contributing factor.
Ms. Mohammed, what are some of the signs that persons can look out for, persons who may be considering suicide?
There are many signs that we can look out for, where we notice our loved ones, their actions may differ to what we consider a norm. So let's say I am an extrovert person, and suddenly I just keep to myself, I'm introverted, I don't want to speak to anybody, you know, that is one sign that something is definitely happening with that person. We also have where persons would become you know, remorseful. They will be apologizing for behavior. Sorry that I'm a burden to you. You know, this won't be long, and words like that they would be using. They would also give away their most prized possessions. So they would be giving persons things that belong to them that they would hold a value, and you know, it is out of context, strange behaviors. We also have persons who they don't take care of their hygiene as they would have previously. So we would say a person is accustomed to getting up on mornings, taking care of themselves, grooming themselves, and suddenly you notice there's a foul odor, they wear the same clothes daily, there's no changing. Those are some of the main signs that we look for in persons who are having suicidal thoughts.
Okay. And following the launch of the hotline, how does the ministry and by extension the government of Trinidad and Tobago intend to play a more active role in the suicide prevention?
Subsequent to launching the suicide hotline, what the intent of our ministry is that we also go community-based, where we would be having a suicide prevention program that will engage community members and informing them of the different signs to look out for in the event of suicide, what can be done, how it can be treated, and all of that, so that we can build resilience on a community level. So that I know that is what the ministry has in store as a result of the data that will be collected from the suicide hotline.
Mm-hmm. And Ms. Alexander Jakey, what sort of information does the hotline have so far in terms of persons accessing the hotline, and is there any differentiation in terms of age group or social status or anything like that?
So we have more females calling the hotline. We don't really pay much attention to persons where they work or anything like the status in life, because we want to save lives. So the initial goal of the suicide prevention hotline is about saving life. So yes, we have data we correlated where females, the elderly, is accessing the hotline, and persons who may be unemployed, who is having family issues, family crisis. A lot of people are going through family dynamics, and they call to get that kind of support. So yes, it is a suicide prevention hotline, but we get calls from different types of calls. So we have the elderly abuse, we have child endangerment, so we have different types of calls coming also, mental illness, yeah.
And what happens to those calls that don't necessarily require the services of a suicide prevention professional?
Right, so what we do, we have a very robust referral system. So as I would have said earlier on, it have internal and external. So this, depending on what the caller is calling about, we will then ask, of course, because of confidentiality, do you want me to refer you to this service? So we do send the form or the application forward so they can get further intervention. Yeah, so they're not left because, yes, this is a suicide prevention hotline, we don't know. We accept every single call. And the call, we have a service 24 hours. So it could be 1 o'clock in the morning, it could be 12 midnight, it could be 10 in the morning. We are there 24 hours.
Or what is it a requirement that persons have to provide things like your personal information, your name, your location, that sort of thing?
So you don't have to, however, it is advised. Because if we have to get further information, further follow-up or referral, then we will need these things to seek further intervention for you. So it is advised, yes, because if you want help, then there's a way we can help you by getting this information to forward it to the relevant agency or division.
Mm-hmm. How many calls has the hotline received so far?
So far it's over 500 plus. And since the launch, we could probably say over 700 and something. So yeah, so the word is getting out there.
Ms. Mohammed, Yeah, I know you mentioned some community outreach with regard to the hotline and its awareness. What other community-related activities or awareness activities are being embarked upon to ensure that persons really know about this hotline, the importance of the hotline?
So we have various avenues in which we promote the services of the National Family Services Division. So therefore we have televised programs that persons are made aware of. There are radio programs, any media, sometimes it's published via print. So those are the main areas in which we also do a lot of community work. We have a parenting unit as well under the National Family Services Division. So within the parenting program, some of these topics are touched on, and our promotion of the hotline would be incorporated within these things. So there are various ways in which we as a division, we send out that information to the general public about all services that is provided under our ministry.
Okay. Now, if I needed to make a recommendation, a member of the public needed to make a recommendation about how to improve their experience with the hotline, how can they do that?
So we are open to constructive criticism, because that's the only way in which any organization can grow. So persons can call our corporate unit, they can call the National Family Services Division unit directly. They can even call the hotline and give that information as to, I had this experience with the hotline and I feel as though if you all did it, in a different way, it might be. And then when we have our meetings, we get together, discuss, positives and negatives that came out of, our clients' experiences, and then we can tweak our programs to suit.
And Ms. Alexander Jakey, what are some of the challenges experienced since the hotline's launch?
Well, to date, I cannot say we have any major challenges, because everything if something comes up, we deal with it immediately. We have a very supportive system from IT department, communication, management, executive. So it is not like, we do have the support. The support is there from the entire ministry and even from other stakeholders. So at this time to date, we didn't have no negative feedback from the public as yet that, this didn't work or anything like that. So, but if we do, as Ms. Mohammed said, we do have a system in place where clients can call and say, this didn't work well, and I mean, if we are offering a product or a service, we should be open for criticism, how we can improve, because change is necessary. So yes, we have a system in place for monitoring and evaluating our service, so the citizens get the best out of what we offer.
I know you mentioned feedback and no negative feedback, but what sort of positive feedback then?
So right, so we from November to now, we do have positive feedback where clients would have called back to the hotline and said, thank you for listening, thank you for referring me to the social worker. So there's some of the positive feedback we got so far. So to date, we had no negative, but so far we have, and we document when they call, or part of our monitoring and evaluation process, we have that when client call back, whether, as I said, positive or negative, we have document and see how best we mitigate it. So thus far, we have a lot of positive so far, with some persons calling back to actually say thank you.
So do you think then that the hotline is making an impact in the lives of persons who need it?
Most definitely, yes. And we are going to continue to grow, because we're looking at implementing the web chats where persons could be online, and the persons who might be here, the disabled, they can web chat us, even the person who might be, as I said, bilingual, and they will have access to that service also. So we're working very closely with the disability unit of the ministry to have that service implemented to the citizens of Trinidad and Tobago who are disabled or differently able.
What other technological advances or human resource advances are being planned for the hotline in the future? So
presently we have training, so we're looking at, so not the we're looking at training where the staff are being updated with relevant information so we could give the best service to the public. What's the question again?
What are the technological advances? You know, you
Right,
mentioned the web chat.
Yes.
So are there any
We
other
also,
advances?
okay, so we also looking at utilizing social media. So we're looking at Twitter, Facebook, you know, YouTube. So anything we do, person would have information out there, access to information. So we tend to utilize technology, even with the disabled and with Dretchy, so the person who is hearing impaired, you know, how do we now serve that population? We are not leaving anybody behind. Every life matter.
And Ms. Mohammed, what about schools? Are there any implementation or interventions in schools?
So definitely, as we have social workers at different categories. So in schools, there are school social workers who are attached to various schools across the country who would provide those services. However, we do collaborate with those social workers to facilitate workshops and so forth. So if the Ministry of Education, they are facilitating a workshop with regard to any topic, they can collaborate with us, and we usually work as a team in order to address the issues at hand.
Well, statistics say globally, persons ages 15 to 29 years old are the ones most at risk for, you know, suicide and suicidal thoughts. Are we addressing that age group directly?
Yes, we are, because as I said, intervention programs are planned and geared towards life changes. So what we must understand is that, you know, we are trained to understand the developmental stages of children, and the reason in some instances that we have so many persons at that age bracket wanting to commit suicide is because there are so many changes that happens within, and having those changes within it talks about confusion. So we have sexuality, we have hormones raging that, you know, I'm feeling this way and I'm not sure how to deal with it. We have parental issues where the parents and the child, there's lack of communication. So there's so much confusion going on within the minds and the bodies of these young persons that they aren't aware how to properly rationalize and, you know, think through things. So by having social workers implement programs and get towards, and this is one of the reasons why we have school social workers in Trinidad and Tobago, where they're going and they hold different discussions. As I said, we plan workshops collaboratively with the Ministry of Education so that we can address issues not only with the children but with their parents as well.
Now, bullying and cyberbullying is something that is one of the causes for suicide among especially that age group. Is that also being addressed?
Yes. So all those areas, as I said, as long as it's an issue that affects a child of a school age, you know, what happens is the school social workers would plan those programs that are geared towards, so it's specific to schools as well. So, you know, a needs assessment must be done where you would see this is the need within the school. So if bullying is not a major impact, there may not be a full-blown campaign around bullying, but it may be something else. So those are the ways in which we strategize to implement the best program for best practice within, you know, schools and communities.
And Ms. Alexander Jakey, where can persons go to find more resources on suicide prevention or any other programs falling under the Ministry of Social Development and Family Services?
So most definitely they can contact the ministry website at www.social.gov.tt. They can also check our Facebook page, social media, Twitter page, and other resources. In addition to the World Health Organization, they also have resources. And of course, they could call the hotline and we can help them with information also.
All right. So final thoughts, ladies. We will start with Ms. Alexander Jakey.
Yes, I want to thank you all for having us this afternoon, and I want to plead with the citizens of Trinidad and Tobago, the people of Trinidad and Tobago, your life matter. Give us a call at 800-COPE, 800-2673, and there will always be somebody at the other line waiting to listen to you. We care about you. Our ministry care about you, and have a support system in place so we can assist you to see your true potential. Thank you.
And Ms. Mohammed?
So I would say suicide is everyone's business. If you know someone who has suicidal thoughts, who is displaying any suicidal ideations, especially young persons who are cutting, though that is one of the major signs, withdrawal syndromes, anything like that, please reach out. There's always help. A lot of times persons who want to commit suicide doesn't really want to die. They just want that pain to go away, and reaching out can assist you with making that pain go away.
All right. And just so that we drive the point home, can you give us the hotline number and any other way that we can get information or persons can contact the office or the hotline?
So that hotline number would be 800-COPE. You can also reach out to the Ministry of Social Development and Family Services via the ministry's Facebook page. Send us a message on Messenger. We'll be more than willing to respond there. We also have the website where you can go on and you can access the different divisions of the ministry so that we can meet your need. You can also call 623-2608. That number again, it's 623-2608, extension 6701, all the way up to 6711. Somebody would be at the end to answer.
Yeah. And I hope that Trinidad and Tobago is looking. I know that persons will now be more informed so that they can have access and receive some help. Yeah. And that's our show. Thank you, Mrs. Alexander Jakey. Thank you, Ms. Mohammed, for joining us on this episode of Delving Deeper.
Thank you.
Join us again, same time next week for another episode of Delving Deeper. I'm your host, Diana Carter, and from all of us here, have a good night.